For joining us. Welcome to Tackling Wicked Problems, Leading Solutions in Digital Health. My name is Catherine Anderson. I'm the Program Director at Innovation Central Adelaide, and it's an absolute delight to welcome you here into the room. As I do that, I absolutely want to acknowledge that we stand today on the traditional lands of the Kaurna people. I pay my respects most wholeheartedly to elders past, present and emerging. And I acknowledge the connection to country that has never been ceded. So Tackling Wicked Problems in Digital Health today's event is a collaboration between the Flinders Digital Health Research Centre, Innovation Central Adelaide, the Medical Device Research Institute and the NIN, the National Industry Innovation Health Alliance. There are a few things that we want to do today together with you all. Innovation is the core word of the day, and what we want to look at is how innovation is shaping the future of healthcare and being able to lead bold and collaborative solutions in what we do. I'm also pleased to welcome you here to Flinders at Festival Tower, to Flinders University at Festival Tower. And this building and this location for Flinders University really concretes or cements the commitment that Flinders University has to the heart of South Australia. So, of course, we are here right next door to where government sits, where policy decisions are made. And fleshed out. And as a university, we hope to have impact on those policy decisions and input into how we run what we do as a state. And of course, being in the central CBD, we're part of the Central Business District and part of this health innovation precinct that goes across North Terrace. If we step outside to the train station, in a few minutes' time, we find ourselves at Tonsley Innovation District, which is the home of Innovation Central Adelaide, MDRI, FDHRC, Factory of the Future. And there we have, a living lab where we get to play with some of these technologies and start to really build out the future of how these innovations happen. A couple of notes of housekeeping. We will keep the western doors open for you. Tea and coffee is continuous throughout the afternoon, so please feel welcome to pop up anytime you need and refresh. There's a fruit platter and there's some biscuits there for you as well. I hope you have loaded up a plate for now. Bathrooms are out these western doors and then keep turning around to your right. As you reach the beautiful view on the eastern side, you can not only have a look over Government House, but you can turn left through the glass door and you'll find the toilets up there as well. Should we need to evacuate, of course, you will hear the first alarm that will alert us to the fact that we might be needing to evacuate sometime soon. Should that progress to a second alarm, we'll take the stairs in an orderly fashion and head down to Festival Plaza. We are taking photographs today. We're recording the whole session, so anyone who's standing up in this kind of area will be recorded. So all of our speakers, that will be our speakers who are standing up in this section here, will be recorded, and Belle will be taking some photographs during the day as well. We'd love to tag you on LinkedIn. We'd love to have you follow us on LinkedIn as well, of course. If that's not a comfortable thing for you, that's not a problem. Just please let Belle know, and we'll follow suit. I've got to advance a slide or two, don't I? There's me. You can see me. I'm here. So I'm the Program Director of Innovation Central Adelaide. We have a great agenda for you today, some excellent speakers. I am going to step sideways and welcome our first quite soon. You do have an agenda on your table, a printed agenda with some bios of everybody here. Please feel welcome to take that with you. And if there is anyone on that agenda that we can help you to connect with more directly, then please let us know. Collaboration is the aim of our game. Today's event is proudly sponsored by our NIN Tech partner and Health Alliance Advisory member, Architech. And I would like to thank Rob for your sponsorship and support of today's event. Thank you very much for your support, and particularly important, the provision of some networking drinks in our showcase following our speakers. So at about 4:45 today, we'll wrap up with some Q&A and we'll head out for some networking drinks, and we've got 3 demos to show you out of that. And before that salubrious part of our proceedings, we're really excited to showcase what we have for you here today, pioneering research and applications. from us all. Before I move on, Slido questions and comments. I mentioned we'll have a Q&A. Our Q&A will be a little bit different to sometimes how it's run. Please grab your phone, aim it at the screen and jump onto Slido. Join us on Slido. We're using Slido to collect all of your questions and your comments and your insights, and that's going to guide a Q&A. We're going to ask Professors Trish Williams and Karen Reynolds to join us up the front for that Q&A session, and they will tackle sort of 3 key themes, bringing our other collaborators in the room into those conversations as we need. So you will have that reminder again for Slido as we go through the afternoon. Excuse me, but there it is for you now if you jump on, and the passcode is WICKED. And finally, Innovation Central Adelaide is our Cisco Research Chair, so Innovation Central Adelaide ourselves, the Cisco Research Chairs, our Cisco Industry Alum and the Health Alliance are all part of the National Industry Innovation Network, or the NIN. The NIN is a network of universities and companies united by a shared ambition to use digital technologies for Australia's benefit. This aligns really strongly with the work of Innovation Central Adelaide, where we bring together academic expertise, industry needs and student talent to turn ideas into real solutions. So it's a core part of that collaboration. We know that Australia excels in research, but we also know that we lag behind in terms of an OECD nation to that industry research collaboration, and that's really key to what the NIN is and does in creating a bridge to across that gap between university and industry. And at Flinders, especially within Innovation Central Adelaide and our partners here today, we support that mission by helping partners to turn concepts into action and by providing that front door, if you like, or a concierge service, a welcoming face, I hope, and some connections internally across the whole of the university. Critically, the NIN is industry-led. It focuses on large-scale digital solutions that shift business and operating models while building essential digital skills and capabilities across Australia broadly, and looking towards NIN's ambition to be Australia's leading industry-led digital innovation network. Flinders and ICA are really proud to play a very vital part in ensuring that local innovation has a national and global reach. That's about as much as introduction as I have for you, because I think we really need to hear from our speakers today. Trish, I probably don't need to have speaking notes to speak to Trish, but there's a couple just to make sure that I get everything right. I've had the absolute pleasure of working with Trish over the last about a year and a half, working here at ICA. Trish is the first Cisco Research Chair across Australia, having had that conferred upon her in 2016. And she is a Professor of Digital Health Systems at Flinders University, where she directs the Digital Health Research Centre and the Cisco Flinders Digital Health Design Lab. She is internationally recognised for her work in health informatics and cybersecurity, and she's authored over 140 publications and co-leads global standards bodies, including HL7 and ISO. With 30 years of experience in healthcare computing, she is a Fellow of the Australian Academy of Technology and Engineering, and she was named one of the 2021 Brilliant Women in Digital Health. I think she's quite brilliant. I hope you do too. Trish, the microphone is yours. Please welcome her.
Thank you, Catherine.
You've got your
live up to that. No, thank you. So, good afternoon, everybody, and I wanted to give you a warm welcome to our symposium today. Hopefully the coffee is strong, because our problems are going to be wicked, and we have enough people to tackle both this afternoon. It is really nice to see so many people here, you know, researchers, clinicians, academics, engineers, and industry leaders, because I think one of the things that is really important in solving any sorts of problems, but particularly wicked problems, is having a collaborative and multidisciplinary approach to the problems. You're never going to get them by just looking at one singular discipline. So, you know, over the years, research has changed, and we now realise that everything needs to be collaborative. And at Flinders particularly, it's one of the main essences of what we do, and the fact that the research that everybody does around Flinders is very much geared to some practical application, which is, you know, the links with industry, as well as what everybody wants to be able to do is to make a difference, and we only can do that through collaboration and obviously application to industry. Today is a celebration of what we've done over the past year and the remarkable progress, and I'm sure that you all have examples of where you know, digital health has really come on in leaps and bounds. But we have seen enormous potential as well as growth in things like medical device innovation, and Karen is going to talk about some of that today, or not. She might talk about Dougal, which is this enormous groodle who looks like a llama that she has. We're going to hear about AI and patient safety from Vince, who is a standards tragic. So, you know, everything is around international standards. We've had lots in national partnerships and new models of care. Our national partnerships, Nithya is going to talk about some more to do with the NIN and what we're doing in that health area. The new models of aged care, Alison is going to give us some insights around some of the work that she is doing in that area and that we've been doing as a group. And also things to do with the ecosystem, and there's a particular project that Brendan's going to talk about to do with social wellbeing, which has been an offshoot of some of the other work that we've done previously over the last, you know, 7, 8, 9, 10 years. Long time. Anyway, you know, I think the only thing that doesn't change is we have many more acronyms, particularly if you work in the standards area, many more acronyms than any human could possibly remember. So all of this happens while we're trying to grapple with these wicked problems. Wicked problems don't behave, they don't respect boundaries, they don't follow governance frameworks, and they refuse to wait patiently, you know, in line like some other problems do. So they are stubborn, they're messy, they're all the things that we find difficult to get hold of. But I think that we have people here in the room, and people that you probably know, that collaboration to help build solutions to some of those problems is something that we can really start to have those conversations about. Wicked problems don't get solved by accident. They rarely sit, as I say, within one discipline or one organisation or one technology, and they do require that persistence, that collaboration, and the way that we look at challenging the assumptions of what we thought we knew. So we are making progress in that area, and that's mainly because of most of the people in this room, and also the fact that people are willing to try to give insights, which is also what we would, you know, like you to contribute today as well, and what digital health might look like in the future. But it's about getting those, you know, group of people to work together more, and therefore today is a bit more of a launch pad, looking forward, imagining what's possible, etc. So the world is not going to be slowing down anytime soon. And for those of you that are younger, of which there's quite a lot of people in here, everything just gets faster. Okay, when you're young, you think you wish things happened faster and time would go faster. And you get to my age and you think, oh God, I wish things would just slow down. So, you know, there are things that, you know, our ageing population, present company excluded, health systems are under pressure, more expectations from health consumers. We used to call them patients, but now we call them health consumers. There is, you know, people are more empowered with their own health, and that has been reflected a lot in some of the problems that we're beginning to see. So I think today is a lot about monkeys. No, it's a lot about what if and why not, instead of just saying, well, we can't do that problem. Well, why can't we solve that problem? What is it that we're not looking at? What if we did something and turned it on its head? And that's the sort of thing that, I think we're after in trying to solve some of these wicked problems. Joining the dots between AI, aging, cybersecurity, social well-being and medical devices, all of those things work together. And in my world, they all work together. So often they're not necessarily always linked, but I think looking at new ways of delivering care, but also I think there's an equal amount of pressure that needs to be put on to try and support clinicians better in how to do that. Because so often in the past, we've thrown technology at healthcare and clinicians, and that doesn't work. It's like cybersecurity saying, well, you need to do it this way. The bank can tell you how you access your money, and I'm afraid that you just have to do it however they want it, or you don't have access to your money. You cannot do that in healthcare. You can't say you now need to do this in this particular way. It doesn't fit well with workflow, and that's why healthcare is an unusual area to be working in from that sort of respect. You just can't interfere. You have to integrate with that workflow. So most of you who know me will know that my research areas are very much around digital infrastructure, cybersecurity, standards, anything that is supporting that delivery of healthcare and healthcare innovations. Go back. Oh no, I can only go forward. This is Scarlett. You should see how long it took me to get her to wear that hoodie and sit at the computer. Zero trust is something that people will hear about in cybersecurity. The challenge in security in healthcare is that we no longer have a castle and moat, and security people like to have a big hug, right? We want control over everything. And that has become a bit of a problem because we now no longer can do that in a very effective way. So we have to look at new ways of doing that, as I said, without disrupting care. And the solution to that is a huge umbrella in my world. Develop this huge umbrella, and it's about how do we integrate what we have and what can we use already that then doesn't disrupt this. So some of you will come across the terms clinical zero trust, which doesn't mean you don't trust your clinician. It's about, how do we make some of those things safer? We're recently doing a project that several of my colleagues, including Gihan over there, and Thomas, wherever he is, on looking more at cybersecurity and medical device because, I've done a lot of medical device security things in the international standards area. We're also looking at how do we adapt better Wi-Fi 7 in healthcare. We did a whole lot of work around what are the problems that we get in healthcare from things like wireless technologies. And there's a lot of clinical incidents that are related to those technology things. And how do we update that, in relation to Wi-Fi 7 and what's coming next? And one of the demonstrations you're going to be able to see outside, which was done in collaboration with ICA and with Alistair, wherever Alistair is. And there we are. I would encourage you to go and have a look at that because that's also really something that's very South Australian related. So really the mindset for today is how do we look at things differently? How do we inquire more around what is going on? So I encourage you to approach today with curiosity, with a sense of possibility, and share your thoughts with us, whether it's through Slido. You don't have to ask questions, you can just make comments. And I think hopefully today we'll have a lot of interesting ideas and conversations, and that we'll set our sights on what we can build together.